السلام عليكم ورحمة الله وبركاته. اللهم صل على سيدنا محمد وعلى سيدنا محمد كما صليت على إبراهيم وعلى إبراهيم إنك حميد مجيد. اللهم بارك على سيدنا محمد وعلى سيدنا محمد كما باركت على إبراهيم وعلى إبراهيم في العالمين إنك حميد مجيد. I want to thank Khalil Center for allowing me this opportunity to speak to you all about naturopathic perspective on fasting. The title of the presentation is Behind the Scenes, is kind of what I speak to my patients about on a daily basis, and specifically the Muslim patients when it comes to fasting during the month of Ramadan. So in order to understand completely the topics that are going to be covered, we have to talk a little bit about naturopathic medicine. All right, so let's see. We have the outline right here. It's going to be a little bit about naturopathic medicine, how fasting benefits the body, the basic physiology of digestion. This is important to understand. We're not going to go too in depth, but we are going to touch some of the basics so that you understand what's going on during the month of Ramadan within the body, how your body uses energy and different forms of energy, and the body's innate ability to heal itself. Also maintaining and breaking the fast, digesting and assimilating foods, what to eat, what not to eat during the month. Okay, so first question, what is naturopathic medicine? We have a paradigm called the nature cure paradigm. And this is basically involves the restoration of health to the body. So our goal as naturopathic doctors is to restore the body to a state of optimal health. And the body is self-healing. For example, when you get a cut on your hand, immediately within 2 or 3 days, you'll notice the body will heal itself, right? If you have an object, you're riding a bike and you fall down and you get scraped and then the bike gets scraped up as well. If you notice 2 to 3 days later, you'll be healed, but the bike will be exactly the same. So that's the innate healing ability of the body. And the body has a desire to be in a level of homeostasis by protecting and healing itself. So our goal is basically to create the conditions for health. And now when you create the condition for health, the body moves in a direction towards healing and instead of breaking down and degrading over time, which is what happens, unfortunately, in our society for many. And also how we do that is by stimulating the vital force of the body. The vital force is similar to the ruh of the body, or maybe actually the ruh of the body, which actually gives the body life and gives it animation. And also gives it the ability to heal. So if you see two different individuals, similar age, similar activity levels and things like that, but they, for example, consume different types of foods. One consumes fast foods, majority of his diet, and the other one consumes very healthy foods. Healthier foods has more of a vital force and will bounce back from disease quicker than the one who consumes fast foods. Now, food is only one aspect, and we'll get into some of the other aspects of the body that can lead you to different types of diseases. Also, persistent disturbing factors lead to chronic disease. So we have an increase in the amount of chronic disease within our society in these days, and it's specifically disturbing factors or removing yourself from the conditions of health which kind of lead to that. This right here is a diagram of what's called the Triad of Health. And I want everyone to focus on the blue triangle in the background where it says chemical, mental, and structural. The rest of it's a little bit more complicated for another day. But the chemical, mental, and structural are the 3 aspects of the triangle and 3 aspects of our lives that actually affect our health. The chemical or the biochemical aspect can be anything from food, toxins in the food or other chemicals in foods, food additives, preservatives, things like that. If you smoke, it's the air quality and different aspects of that. The water that you drink, it can be multiple other things. Anything that's chemical or biochemical that can potentially affect the body is on that side. So if you're consuming certain foods, it can have a biochemical effect, which will throw that side out of balance. And you have on the right side the mental and, let's say, emotional as well, mental emotional aspect that can also throw your body out of balance, right, and shift the triangle off of the midline. And that can be from past traumas. I used to work in as an intern at the Salvation Army Clinic. We took patients that were coming right off the streets people who were drug addicts and trying to get sober, people who were homeless, get a lot of gang members. So these individuals came into us, and majority of their problems were actually mental emotional because of the number of traumas that they've been through. So correcting that is extremely important. And then on the bottom, you have structure. And I see a lot of patients come in with structural faults. It can be anywhere from the time of their birth, when they came through the birthing canal, it was, let's say it took 24 hours for the baby to come out, and they had a lot of pressure on the skull during that time. They may have certain faults in the skull that you can actually put some pressure on the skull and you can feel bumps and swelling in different areas. So that can cause a lot of problems throughout the whole system, right? A structural fault can actually cause a mental, emotional, or biochemical fault. So they're all interconnected. For example, if you have a structural fault regarding the diaphragm, right? You could be breathing improperly. And because of the breathing that's improper, right, it will cause a slight level of anxiety. So you'll be on borderline having an anxiety attack at all times because of the structure being shifted out of place. So that can cause some mental problems, mental emotional problems, which can also cause biochemical. Your digestion has changed because of that. So these are all related, and these are the three main aspects of what can cause disease within the body, or dis-ease. So we have to look at the illness model of naturopathic medicine as well to see how disease begins and starts up and what fasting can do for that. If you look at the top, you'll see normal health. And as you go down, you have disturbing factors on the left-hand side. And what are the disturbing factors after you have normal health? What can disturb that? It's these three in the background right here: biochemical, mental, emotional, and structural. We just spoke about those. Those things can be disturbed, and that perturbation in those different aspects can actually cause a disruption in normal function, right? And the disruption in normal function will cause a reaction. Most common ones are like fever and inflammation. So these reactions, fever and inflammation, come specifically from having these disturbing factors. And then what the body in its intelligence and its perfect design attempts to do is actually discharge that. So if you look to the right, you'll see the discharge process. The body will try to get rid of things. And how does the body get rid of those things? It's through heat. So people will have, for example, hot flashes. That's not a normal thing. That's an imbalance in the hormones. The body's trying to potentially get rid of something or push it from the tissue into the blood, hormones and stuff like that. Sweat, the sweat can change in its consistency. Some people have thinner, more watery sweat. Others have a thicker quality of sweat, and that tells you what's going on within the body and how to correct it. Your sweat should be very similar to water. It should not be thick. It should not have a smell to it. So these are things that can be corrected within the body, and that's a discharge process. The body is trying to get rid of or eliminate something to come back into a state of homeostasis. Obviously, you can discharge blood, pus, urine, feces, and the qualities of all of these things changes depending on what's going on within the body. After you have a discharge, then you basically come back to normal health, and that's the acute illness. So above right here, above reaction, a reaction and above, that's all an acute illness. Now, when you go below that, you'll see chronic illness, a chronic reaction, which eventually leads to degeneration. So if you continually have that reaction, fever, inflammation over and over again, and you suppress the body, you do not allow it to have the proper discharge process or go through the process that it needs to go through to reestablish normal health, then what will happen is that reaction will happen again and again and again. You'll get that ear infection again and again and again. You'll get the fever again and again, the same hip pain you have, on and on. And these are basically signs for the body. This is a check engine light. When you have some type of reaction, fever, inflammation, these are phenomenal things. You do not want to shut these things out. You want to ask the question, why is this even occurring, right? And what fasting allows us to do is to remove some pressure off the body so that the body can actually discharge more easily, right? To increase the vital force of the body. So then you get, if you don't allow it to discharge, you get chronic reaction degeneration, which results in ulcers, tumors, scars, atrophy, paralysis, etc. Okay, so let's look a little bit into the digestive process. Since this is very specific to the month of Ramadan, we're cutting back on food, we're cutting back on drink, on water, on different forms of sustenance, so that our bodies can heal. That's one way to look at it. The main reason, obviously, is to gain taqwa. from Allah subhanahu wa ta'ala. But this is a side effect. This is one of the blessings of the month of Ramadan, is that the body has the ability to heal during this time and is given a break. Now, when you look at the digestive system, what's interesting is that there's basically a tube that comes in from the mouth, and it goes all the way down to the rectum. So this tube only absorbs the food if the food is broken down properly, right? So if you're getting, the best, most expensive organic grass-fed meats from New Zealand, let's say, right? Halal, tayyib, everything is good, but you're consuming that food, you're getting a lot of bloating, and your body's not breaking the food down properly. It's coming in one side, going out the other, and you're actually wasting money to a degree. So you want to make sure that your digestive ability is up to par. Also, pay attention to how much space or how much room, this may be a little bit exaggerated, but the amount of room that's taken up by these organs is huge. It takes up majority of the abdominal and some of the thoracic region. And there's a lot of, there's a big purpose behind that, because there's so much going on with the digestive system and all the organs associated with it. There's so much energy and work put into that. So let's talk about energy use in the body. 60% of the body's metabolic energy is actually used for digestion. And that's surprising for a lot of people, because most people think that it's used for exercise, for the muscles, for the nervous system and things like that. But majority is actually used for digestion. And fasting takes away, when you're fasting, you remove this burden, the 60% burden from your body, and you allow the body to heal and use that 60% of metabolic energy on other areas of the body. Maybe you have you're diabetic and you have an ulcer that hasn't healed for a long period of time, and you're fasting, you're noticing, hey, that ulcer is actually healing. That's one example. 30% of the body's metabolic energy is used for brain function, and then 10% of the body's energy is used for muscles and movement and things like that. This is optimal right here. This is what you want, 60, 30, 10. What happens whenever you consume foods that are that your body is intolerant to, has a difficult time breaking down, what happens is that 60% will actually jump up to 70 or even 80%. And then and then as a result of that, patients will notice that their brain function and their energy levels go down. So they have brain fog, and then they have decreased energy. And it makes perfect sense, because if the 60% jumps up to 70, you only have 30% left for brain function and muscle movement, right? So that is important to understand, that how big of a change and how important it is to have good digestion ability and put good food into the body. In order to keep that balance, you want to stay away from food intolerances. One of the tests that I do in my clinic out in the Chicagoland area is called the Carroll Food Intolerance Test. And this tells you which food groups that you're intolerant to. And it's a genetic test, which is great, because it'll last you a lifetime. You get the test done once and it lasts you. Now, if you don't have access to a test, or you haven't had testing done, then what you want to do is use your instincts and your history. So if you know for a fact that when you eat, let's say, for example, dairy, anytime you have dairy, homogenized, pasteurized, normal dairy, then you start having, stomach pain, or you start getting tired, or having brain fog, getting sleepy, any of these things. And that's a food that's putting a lot of stress on your system. It's taking the digestion from 60% metabolic energy usage and pumping it all the way up to 70 or even 80%. And that's why your brain function is going down, your sharpness is going down, and your muscle movement and energy, bodily energy, is going down as well. So you want to use your instincts and find those foods that you know cause you problems, and remove them. The best way to do it is testing, but this is the second best way if you don't have access to that. Okay, so how does fasting benefit the body? Now that we understand a little bit of the physiology, how the body works, let's go into how fasting specifically benefits the body. The goal of fasting is, in general, not during the month of Ramadan, but in general, fasting is used to heal the body, right? To take some pressure off the body, the pressure of digestion. It's been used in naturopathic medicine for over 100 years, and obviously in the Islamic tradition for over 1,400 years. Water fasting is a naturopathic treatment. Now, this is fasting with water, or some people actually use teas as well. There's a clinic in California where they specifically do water fasting as one of their main treatment modalities, and they treat all different types of diseases out there. And you can do anywhere from 12 hours to 60 days on a water fast. And obviously, you want to do this under the care of a practitioner, someone who really knows what they're doing and treating patients using this modality. The main purpose of water fasting and fasting in general, even dry fasting, which is done during the month of Ramadan, is to decrease systemic inflammation. One of the ways that it heals the body, not one of the main reasons, but one of the ways that it heals the body is by decreasing inflammation, fevers, infections, pain. These are different signs of the inflammation. And dry fasting, like I said, is what we do during the month of Ramadan, and also is tremendous in giving the body the ability to heal itself. Now, here's some studies. It's going to be a little bit dry, but I put it in here for those who are interested. The LDL, or the bad cholesterol, and fasting blood glucose usually decrease with a fast. People had a little bit of a weight loss of 2.7 pounds, average weight loss. What was interesting is that within 2 weeks of a follow-up, they gained 1.6 pounds back. So you have to be, watchful over your diet, especially after the month of Ramadan. Females, their HDL, or good cholesterol, actually went up. Males had a decrease in weight, total cholesterol, and triglycerides, which are some of the fats in the blood, which is good. And then there was a significantly lower concentration of inflammatory markers, such as CRP, interleukin-6, and tumor necrosis factor alpha. Now, this is basically telling you that when you pull the blood, you're noticing that the signs for inflammation in the blood are dropping. That's a great thing. That means decreased pain, decreased swelling in different areas, and more functionality and optimal health within the body, because there's less of a burden within the body. Now, these studies were done without giving any intervention. So the interventions that I'm going to give you in the next few minutes are going to be different things that you should do to have optimal digestion, and also what foods and drinks to eat and consume and what not to eat and consume. So when you do this and you add this along with the fasting, you can get even more multiplied benefits and effects from the fasting. Another one of the, a disclaimer that the primary intent of fasting in the month of Ramadan is not to gain these benefits. This is, a side benefit, side effect of fasting. The main goal is to gain closeness to Allah subhanahu wa ta'ala, which arguably you can get by taking some pressure off the stomach and allowing the brain function to increase so that you can focus on your dhikr and ibadat during the month of Ramadan. One of the other studies shows that an extended fasting period or gut rest could also lead to reduced gut permeability and, as a result, blunted postprandial endotoxemia. Now, what this is basically saying is that endotoxemia is toxic, basically increasing the toxic levels in your bloodstream, right? And you can decrease this by giving your body rest. So if you look on the left side over here, see these cells that are lined up. On the left side, these are healthy cells. See the gaps? There's no gap in between here. There's a cleft right here, but no gap means nothing gets through. Now, when you have gut inflammation and you haven't given your body a rest, you're just keep on giving it food. They're doing 6 meals a day and breaking them up. So you're not giving your gut a break or a rest period to heal itself. Then you have these little gap junctions in between that begin to open. And when they open, you have things right here, toxins, coming through, food particles. Now, food particles are fine, right? But when they're this big, they're large, and they're getting through and they're not broken down, the body says, what is this? This is something that's foreign to us, and we're going to attack it. And when the body attacks it, it causes inflammation. And what inflammation is increased. That's why we have pain. There's so much blood is putting pressure on the nerves. And there are cytokines, which are inflammatory markers that come in as well and make your body very sensitive to that area. And then you start having pain signals sent up to the brain. So this is when you don't give your body a break. You're eating foods that are detrimental to your body. And you have all these pathogens and things like that coming into your system that shouldn't be, right? So the studies are actually showing that when you give your gut a break, it actually heals properly, and then you don't absorb these things, and they absorb properly, which is through these little finger-like extensions on top of these cells. The food will come in, it'll be broken down properly, and then it'll slowly absorb into there and come in the way that it was initially intended. Now, in order to digest and absorb food properly, there are certain principles that we have to abide by. If you look at the picture on the right, there's a group of monks sitting in a very serene setting with very small portions of food in front of them. This may not be us during the month of Ramadan, but this is something that we and our families should try to inculcate, kind of serenity during the times of eating. Make sure you're sitting down when you're eating. Now, the importance of sitting down, obviously it's within our tradition and the sunnah of the Prophet ﷺ to sit down when you're eating. But whenever you're sitting down, your sympathetic nervous system drops and your parasympathetic increases. Parasympathetic is the healing aspect of the nervous system. It's the part of the nervous system that increases blood flow to the stomach so that you can digest, and the intestines so you can absorb things, right? So sitting down relaxes you, right? The second thing, chew food properly. I see a lot of people just, you know, when they eat so quickly, they don't chew properly. And remember that digestion begins in the mouth and then it goes all the way through. But the beginning of digestion is not the stomach, it's actually the mouth. So if you're digesting properly, it's likely that you're chewing your food a number of times. And I'm not going to give you a number. You don't chew this many times. I mean, you just want to chew properly, relax, and allow it to be fully digested in the mouth before it starts moving down. That's why you don't want to be in a stressed out place. You may be sitting when you're eating, but if you're sitting in the car, eating your sandwich while you're driving down the highway, that's not the best place to be consuming the food, and you're likely not going to chew it properly. You're probably going to scarf it down. You don't want to overeat. Now, this is a given, especially during the month of Ramadan. You want to kind of hold back on eating too much and putting too much stress, especially after fasting for such a long period of time. And then, when I break my patients' fasts, when I have them break their fast, if they do a 1 day or 2 day water fast because of a fever or some type of other illness that's going on, I'll actually have them break the fast on a vegetable broth. And they won't eat the vegetables, they'll only have the broth at the beginning. And then if they're still hungry, I'll let them eat the vegetables. And if they're still hungry, then they can wait a few hours and then have their next meal, which will be rice and steamed vegetables. So it's a very specific way of breaking the fast so that the body has the ability to increase and start the digestive processes back up. It's not like first thing you eat is a 10-ounce steak. That's not a very intelligent way to restart the body up. And then relaxing your mind while eating. And this is, what these individuals in the picture are doing to the right. No controversial topics at the table. That's a very important tradition that, people have, that they don't want to bring up anything controversial at the dinner table. Because when you're eating your food and you bring up something controversial, all the blood shunts from the stomach, from the gastrointestinal tract, all from this region, it'll shunt to the extremities. Because when you go into a sympathetic state, you're talking about politics, or you're talking about, an argument you had earlier today, and immediately your body goes into a sympathetic state and the blood starts rushing to your extremities. And this is because we've been designed to have sympathetic overload or sympathetic stresses that lead us to having, to give us the ability to run away from different things. For example, if you have a cheetah, not a cheetah, a tiger or something like that, chasing you, you want to have your blood in your extremities. You don't want to have it in your stomach, right? So this is one of the reasons that we have this sympathetic response. Something stresses you out, immediately you have this response where now you have blood in the places that you want to have it to fight off this enemy or run away, right? So you don't want to have that when you're sitting at the dinner table. You want to be calm, you want to be relaxed, make a prayer, ask for forgiveness and be thankful for what you have sitting in front of you, which a lot of people are not as blessed to have, and especially during these times. So definitely make sure to relax the mind while eating. In regards to liquids, I have a few rules. A lot of people want to drink, 16 to 24 fluid ounces of water or Pepsi or whatever during their meal. I tell all my patients, drink small amounts during the meals. And this, if any, and if I'm not mistaken, the Chinese actually say that you should have water either 20 minutes before or a drink 20 minutes before or 2 hours after the meal. There's a lot of wisdom in that as well. I'm sure we have something in the Islamic tradition. But when you're consuming water or any other drink, the hydrochloric acid that sits in the stomach, the acid that is required to break down the food into very small particles so that you can actually absorb it, becomes diluted, right? So anytime you want to dilute something, you just add some water to it. Same thing in the stomach, right? So drinking a lot of water, people feel really bloated after the meals, and they have no idea why. They're like, I don't know why, I'm just really bloated after my meals. It's because they're drinking these large amounts of water or any other drink. And you want the temperature of the drink to be warm or room temperature. You do not want it to be cold. When you're drinking something cold, what happens when you hold something cold? Your hand gets really cold, and you notice all the blood vessels on the hand will actually start to close off, right? The blood vessels will not be open, right? And they'll close off, and that's the same exact thing that will happen in the stomach. The blood vessels will close off. So the blood that's bringing all the nutrition and the energy to the stomach so that the stomach can function properly kind of shut off. On top of that, the enzymes, which are like little Pac-Men within the stomach and the intestines, will actually slow down in their activity because they need to be at a certain temperature to be functioning properly and to be functioning optimally. So you do not want to have cold, warm water, and room temperature water is good to drink around the meal time. So that'll help you with having optimal digestion. So let's talk about maintaining and breaking the fast. Some foods definitely to avoid: high sugar foods, outside of fruit, of course. And even fruit you want to have in moderation. You don't want to have like, 10 apples, 10 oranges, or anything like that. And I specifically said fruit and not fruit juice, because fruit juice would be considered a high sugar food. It's processed slightly, and they remove a lot of the fibers from there. Sometimes they pasteurize it, so it breaks down some of the enzymes that are required to help break down and absorb the food. Overly refined and processed foods, these are kind of given. Anything that's in a package, and we'll talk a little bit about some of these. Any packaged foods, what they do with packaged foods, and I talk about this in some of my lectures on my website, which I'll give a link to later in the talk. But what they do with packaged foods is that the goal is actually to keep that food for as long as they can on the shelf so that they lose the least amount of money. Because whenever a food goes bad in, let's say, 3 weeks, after 3 weeks, whatever didn't sell is gone, right? So the goal is to keep that food on the shelf for as long as possible. That's the goal of the industry. The goal of the human or the consumer is to get the healthiest food possible. So you want what's going to have a short shelf life in general, right? And then consuming large amounts of coffee and teas that are caffeinated. This basically has a diuretic effect on the body. And what that means is that when you consume these things, they make you go to the bathroom and to urinate, and you can have some dehydration because of that. Coffee, I take all my patients off of. I know a lot of people are going to disagree and be upset with that statement. Anytime I give a lecture anywhere, when I bring up that statement, I get a lot of questions and a few angry people after making that statement. But it's just what I've seen in clinical practice. My mentors have seen that as well. And when people consume coffee, they have a lot of inflammation in their body. I drink black tea, but I only drink it during times where I really need it. So for example, when I wake up in the morning, or anyone wakes up in the morning, they should have enough energy to get through their day without the requirements of, a cup of coffee or a cup of tea or a few cups of tea to get the caffeine to get their body boosted. They should have an endogenous or an inside energy that's pushing you forward throughout your day. So having some tea here and there is okay. I'll have it before giving a lecture or a big event or something like that, where I need to be very sharp and on top of it. But outside of that, I don't think it's a great idea to be drinking large amounts of tea. You're burning, especially caffeinated teas. Herbal teas are fine, but when you're drinking caffeinated teas, you're also burning your adrenal glands out as well. And you're pushing your body to a limit, and that's breaking your body down over time, right? You're not building your body. There's two things. You can either be building your body up or breaking it down. And when you're drinking a lot of caffeine and caffeinated products, these patients that come in after drinking a lot of these, I have to give them certain nutrition to build their body back up to a place where they can actually function without these things. And then it's a given that foods with artificial colors, flavors, preservatives should not be consumed at all. They shouldn't even be brought home into the house during Ramadan, outside of the month of Ramadan. I would even go out as far as to say anything with natural colors, flavors, and preservatives as well should be removed from the diet. These companies have gotten very slick in their marketing. They know that the consumers want something that's natural, quote unquote, but now the word natural has no real benefit. If your great grandparents couldn't find it on the shelves of the supermarket back in the day, or the farmer's market, then you probably shouldn't be eating it or eating too much of it. These are some foods to avoid. Although the picture on the bottom right of the cake looks quite delectable, We want to stay away from these things. A lot of artificial colors, flavors, all these things kind of bog down the body and the digestion. This pack of Oreos right here can probably stay in the shelf for 10 years. That's problematic. I mean, maybe not 10 years, but a long period of time, and that's really problematic. The fats and the oils that are found in here are probably rancid by the time that they get to you. In drinks like this, Coca-Cola, Pepsi, Sprite, I'm not throwing just Coke under the bus, but all these drinks have highly available sugars. All of these foods have highly available sugars, and they spike your blood glucose dramatically, and then it drops, and you don't have proper focus. You don't have proper emotional balance when you consume these foods. So it's really important, not only for your sake, but for the sake of your family. If you have kids, you don't want to be eating this food, and then when your child does something that normally you wouldn't get upset about, now you're really upset. You know, you're yelling, and you're creating a negative environment for the children. So you want to make sure that you're in the best state possible for your kids and for the next generation. This can traumatize them, and then, you know, cause a vicious cycle going down into generations. Some foods to consume: nutrient-dense foods like fresh fruits, veggies, nuts, beans, and meats. And specifically when it comes to beans, like lentils and stuff like that, you know, we as Muslims, we consume a lot of them especially during the month of Ramadan, even outside the month. You want to be soaking these beans. Historically, people have always soaked them in water and, let's say, lemon juice or raw apple cider vinegar for a night, sometimes only a few hours before consuming it. And the Weston A. Price Foundation has a lot of really good information regarding how to soak these and what happens when you soak them. And what happens basically is that the anti-nutrients or the toxins within the food that protect the beans and the lentils actually get removed from the food, and then some of the good beneficial nutrients become more available for absorption. So your body doesn't have to work as hard, basically. And what I noticed back when I was a kid, my mother actually used to put these beans into a bowl with water, and she used to leave them over a night or two in there, and then until they started to sprout, and then she would eat them raw like that. And I always wondered why she did that. And now after studying, I realized that, you know, she was actually allowing the food and time and nature to do its work to break it down and for the sprout to come out. And this is called sprouting. And she would sprout it and then eat it. And mashallah, she has decent health right now. You want to be consuming fatty foods, specifically because of the fact that they give you so much energy. You get 9 kilocalories per gram of energy expenditure from fats, compared to proteins and carbs, which only give you 4. So you get more than double the amount of energy per gram for the same amount of fat than you do from proteins and carbs. So you want to be eating a decent amount of fats during this Ramadan to give you energy throughout the day. Now, I'm not saying eat a ton of fats and, you know, decrease proteins and carbs in general, but fats are good for the body. The whole idea that you don't want to eat fats, there's a lot of new research in the past few years that has been coming out that's saying that fats and cholesterols are extremely important for the body. And I have talks on my website going more in depth into some of these topics. Some of the fats that I recommend for patients to consume is ghee, tallow, butter, and coconut oil. Canola oil, things like canola oil, vegetable oils, sunflower oil, these oftentimes are rancid fats, or they become rancid very rapidly, and they cause a lot of degeneration to the body. Things like ghee and tallow, they have a high heat level. So you can basically, their burning point is very high. You can fry with these fats, and historically that's what we used to use for frying. We used to use ghee and tallow. We used to put that in our biryani and our different foods. There's a recipe for tallow French fries on the Weston A. Price Foundation website. So you can use tallow as basically beef fat, rendered down beef fat. You can get it from your local butcher shop and render it down in a slow cooker. So these are really healthy fats that we should be consuming. And consuming whole fat products in general. No skim milks. First of all, I recommend raw milk and raw dairy products in general. There's a lecture on YouTube that was done at Harvard University where they actually debate whether raw milk is better than non-raw milk, which is really interesting. But there's a huge debate regarding that. But I recommend raw milk and not skim, not 2%. You want to have the whole fat milk, right? because that's how it was designed. And the fat is required for calcium absorption and different things like that, which is found in the milk. You want to have pure water and herbal teas. When I say pure water, I mean filtered water, not pure as in tap water. And pure water from a Berkey water filter is what I would view as one of the best sources. Spring water is probably the best out of all of that, but a lot of people don't have access to a spring, me included. There is one in the Chicagoland area near the airport, but I haven't gone there. So what I do is I have a Berkey water filter, and we have a picture of that right here on the bottom. That right in the middle, the metal one, this is called a Berkey water filter, and it has it's a phenomenal filter. It's the cost of it per gallon is 2 cents per gallon. They've calculated it out, and it'll last a lifetime for you. I mean, you'll have to change the filters out every few months, every few years or so. Up to 6 years it can last. So that type of water filter is extremely important to have for your family. You want pure water. A lot of chemicals in the water nowadays. What happened in Flint, Michigan is not isolated. It's probably in other counties as well. So getting pure water is extremely important during the month of Ramadan. On the top right, we have some butter. On the bottom right, we have tallow. This is when you render it down. This is a beautiful picture. I have tallow in jars. I actually render it down myself for my family. And I have a few jars in the fridge, and then I keep one jar out, and we use that for our daily cooking. Fruits and vegetables, amazing. You have phytonutrients in here. You have a lot of fiber, helps with your digestive system, and it helps with the microbiome, which is the probiotics that live in your intestines. So a lot of these foods will help with that. And on the bottom left, we have different nuts and seeds. I was gonna, these have a lot of omega-3 fatty acids, some fiber, a lot of protein in them, and they'll keep you full for a good amount of time if you have to do a lot of physical activity throughout the day. I was gonna put another picture of organ meats, which I'm a huge proponent of here. Recommended that I don't do that so that I didn't scare away people. But organ meats are great. Here's a sample diet of something that I would have and during the month of Ramadan. For suhoor, sehri in the morning, 3 free-range organic eggs made with 1 tablespoon of ghee or tallow. Keep in mind, these are free-range, organic. You can buy store-bought regular eggs and compare them to organic free-range, and you can see a change in the color of the yolk, which is really interesting. It'll be a much more deeper yellow or a slightly orange tinge to them whenever they're free-range organic. I think everyone should try that for themselves, and the taste is a little bit better as well. And then 1 slice of sprouted organic whole wheat bread with butter. Now, if you look over here, it's actually sprouted, right? So this, because the wheat's actually sprouted the way that it was historically done, the wheat will be easier for the body to absorb. It has some fiber in there, and it's organic, so it doesn't have a lot of the chemicals that break down the lining of the intestines that we spoke about. And then a half a glass of raw milk. And some dates, which also has fiber and some sugars and some minerals in it as well. And then for iftar or dinner, you can have 2 ounces of chicken liver with 4 ounces of chicken leg, half cup of cooked rice, and then 1 cup of fresh carrot juice. This is well-rounded. For some people, this may be too much. For some people, this might not be enough. You don't want to be eating too much during the month of Ramadan, right? The goal is to cut down so that you can focus on worshiping Allah subhanahu wa ta'ala and allowing the body to heal itself. And last but not least, we have the pakora promise. For those of you who make pakoras and samosas and things like that, I want people to convert from vegetable oils and frying in there to frying in ghee and tallow. And I know this is going to be a little bit more expensive for sure, but it's going to have a tremendous impact on the health of the people who are eating the foods. And you can actually, after you fry in these foods, you can, depending on how often you fry in them, you can reuse some of these oils in your other cooking, as long as they have not become rancid. So as long as you're not cooking them 10, 15 times, if you're cooking once or twice, you can reuse the oil. And the fats are really good for the body. So for more information regarding any of the topics that I spoke about, I have some stuff on my website. The ones that are highlighted in green right here and bolded are talks that are relating to the talk that we had today, and these are some other ones that I have on my website. These are talks that I have for my patients, but obviously anyone is free and willing who's willing to can listen to them as well. I want to thank a big thank you to Raheel Center, mashallah. They're doing amazing work in the city of Chicagoland, where I'm from, and also in other places. They're expanding. Dr. Human, mashallah, is a great leader, mashallah, and he has done a lot for the Chicagoland community. So I want to thank him. And then with that, if there are any questions,
Jazakumullah khair, Dr. Raheel. Alhamdulillah, it was very informational and very beneficial. Lecture on this healthier eating. We do have one question, which I think is a little bit long, but I'll just say the whole thing and you can answer the way you'd like. This attendee asks, sometimes I notice that simple carbs like rice make me very tired after about 30 minutes of eating. What can we have to replace that after breaking our fast in Ramadan so that we can keep up with the energy for Tarawih? And then the second part is, could you also give an example of a healthy iftar dinner? But I think you sort of addressed that a little bit.
Yeah. Okay, so consuming rice is giving the patient, the individual, a little bit of tiredness afterwards. So having some fresh fruit might be a better idea, trying that out. Now, it's difficult to answer the question without having a complete understanding of what's going on with the individual's body. Mm-hmm. But trying out fresh fruit and then trying out different things like having meat and different things like that, and trying different things, different food groups is one shot at it. And maybe that the digestion, that his or her digestion is not that great, and therefore any food that's put in the body is actually going to slow it down. You might want to start off with a cup of herbal tea and then let that soak into the body for about 30 minutes to an hour. And then as the hunger comes in, consume foods. I tell all my patients, do not eat unless you're hungry. A lot of people have this concept that, there's 3 square meals a day, or during Ramadan, I have to have, suhoor and sehri, like suhoor and iftar, like a large amount of food during each one so that I can get through the day. If you're not very hungry, have a smaller portion. There's a blessing in having, waking up in the morning and having something before you start the fast, definitely. But you only want to have as much as your body can tolerate, and as much as you want, as much as the body wants, and the body will signal that to you. So maybe if you're not hungry after fasting, if that's the case and you're still eating a little bit of rice and getting really sleepy, then you may not want to be consuming anything, maybe just a cup of water and then consuming, a date and then continuing on with your prayers. I hope that answers the question.
Yeah, Jazakallah khair. I think that does. We do have one final question, if we can argue for another minute. This question is, what's the difference, and I guess how is a distiller different than a filter? I guess referencing the distillery that you mentioned.
Yeah, the water filter. So when you have distilled water, what distilled water is water that is has all of the minerals completely removed from it, right? So when you remove all the minerals, the body has to balance the minerals out. So your body will leach its own minerals to balance the water out. So you can get distilled water, and that's the quote unquote the purest water, right? No minerals, no nothing. Majority of the minerals are removed, if not all of them. And then you can drink that, but you want to put mineral drops in there. And one of the best companies that I use is Trace Minerals. I think it's Trace Mineral Drops. If you look that up, it's a few dollars. You can get a bottle of that and add 2 to 3 drops per cup of water. And even if you're distilling your water, that'll add some minerals to it. We put that even in our Berkey water. We'll take the water out and then we'll put a few drops in our water bottle of the minerals to remineralize our bodies, because unfortunately the soils in the States have been leached of their minerals, and therefore the human beings who are consuming the foods that are coming from there don't have as many minerals either. So